Hi, Wally Taylor from Texas Integrative Medicine in Austin, Texas. And I wanted to just shoot a short video this morning to tell you all about what I learned at the recent conference that I just got back from. I was out in Seattle this past weekend for the Forum of Integrative Medicine 2019. This is the forum that's hosted by Scott Forsgren, the Better Health guy, and Susan McCamish, who's the creator and head of Beyond Balance, which is an excellent herbal company that has quite a few products out for chronic stealth infection like Lyme and Bartonella, as well as products for viruses and to help detox your system. But this was a fantastic 3-day forum that I was able to attend, and I just learned a lot. We had some really fantastic people that were presenting to us. I wanted to take just a few minutes this morning to present to you some of what I think are the key takeaways or highlights that I brought back, things that I'm going to try to incorporate into my practice just as quick as I can in my work with people who are chronically ill with fatigue, fibromyalgia, chronic headaches, chronic anxiety, depression, insomnia, a lot of digestive symptoms, aches and pains in the bones and joints, various autoimmune conditions. So I wanted to start off by talking about some of the things that Dr. Anne Carson said. Dr. Carson is an integrative practitioner of great renown from Pennsylvania, but she gave a talk about some of the critical toxins that she sees in her practice. And as she often does, she started off by saying, mold, 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 mold. And just like in my practice, where mycotoxins clearly are probably the worst toxin that we encounter causing our patients symptoms, she did emphasize that again. But Dr. Carson also was concerned about the effects of toxic metals, which seem to be getting to be more and more prominent in her practice, where she lives out in agricultural farming country in Pennsylvania. In fact, her home is right on the edge of soybeans and corn, and she said, unfortunately, a lot of spraying goes on there. But one of the things she really was concerned about, and she presented a lot of the most recent information about, and that's the molecule glyphosate. You know, glyphosate is a small molecule that kind of mimics the amino acid glycine, looks very similar to glycine, but has a phosphate group stuck on it. And it turns out that it's partly because of its similarity to glycine that it's so problematic. I'll talk more about that in just a second. But glyphosate, you know, is one of the most heavily utilized agricultural chemicals in the world today, especially here in the United States. It's actually a lot of other places like in Europe where they really significantly limit the use of glyphosate because of some of the studies that they've shown of the ill effects of the little molecule. But you know, glyphosate was known for a long time to be an antibiotic. It kills germs. Seems to be also able to kill plants. And that's one of the reasons it's so heavily used is it's an herbicide. It's a weed killer. And if they, especially when they use it with GMO modified or genetically modified plants, they're able to use it to really increase crop yields. They put genes in the seeds of the plants, such as the wheat and corn, so that they resist the effects of glyphosate, and yet the weeds don't. So it's a selective weed killer. Trouble is, a lot of the weeds now are becoming resistant to the effects of glyphosate. And then a few years ago, they did find out that they could use glyphosate as a drying agent for crops. So they've gotten to where they spray it on many grass grains just a few days before harvest, because it seems to help those seeds dry out, can sometimes prevent some spoilage in the silos. At least there's not the mold toxins on the grass grains, but what about the glyphosate? So anyway, glyphosate, when it's on the food that we eat, which is very common. In fact, in my practice, I measure glyphosates in urines routinely, and I have yet to see a zero. We've seen some low ones, but we've seen a lot of high ones, and most people test with intermediate levels of glyphosate. And again, I have yet to see a zero glyphosate in a urine glyphosate test. But we know that it significantly disrupts the microbiome because of its antibiotic effects. We also know that glyphosate, one of the things that it really seems to do that's pretty problematic, is there's some pretty good evidence now to show that in the body, when the body makes proteins, it turns out that occasionally a glyphosate gets substituted in the protein molecule in the place of glycine. So our protein manufacturing machinery mixes up glyphosate for glycine and sticks it in the protein. And when it does this, of course, the protein doesn't behave as it normally would, because the glyphosate with the extra phosphate group changes the shape of the protein and therefore changes the effect of the protein. It changes its shape, changes its structure, it changes its enzymatic capabilities if it's an enzyme protein. So anyway, the key about glyphosate, I think number one is to try to really reduce it in the environment. And that this is going to take public policy change. They did recently, there was a big multi-million-dollar legal grant or legal settlement that was given in California not long ago when a plaintiff was able to prove that it did indeed cause his lymphoma cancer. So decreasing the use of glyphosate, I think, is critical. But then to do everything we can to try to reduce glyphosate intake by limiting grass grains, to try to focus more on organic grass grains where we know glyphosate isn't used. And then there's a lot of different techniques to help the body clear glyphosate. One of the key molecules needed for that, of course, is the detox nutrient glutathione. So that was glyphosate. Then I wanted to talk about some comments Dr. Dietrich Klinghardt from Seattle, Washington made. Many of you probably know of Dr. Klinghardt. He's a very intelligent doctor who practices between Berlin, Germany, and Seattle, Washington. But his big thing this last weekend was he was talking a lot about the effect of human endogenous retroviruses. And it turns out that about 4% of our human DNA is actually made up of viral DNA strands. So we know that over the eons past, viruses have incorporated their DNA into our own human DNA, and then that's often passed down from generation to generation. So some of this viral DNA is inactive, but we know that it's not all inactive. In fact, we know that in some cases, these strands of human DNA, viral DNA become active, and then these viruses known as retroviruses actually begin to proliferate in our bodies. So HIV is an example of a retrovirus, although it's not thought to be an endogenous retrovirus. It's one that we acquire from infection from another carrier. But these other endogenous retroviruses, we're finding out, have a lot of problems and can account for a lot of immune activation, which can end up causing lots of inflammation. And they've been incriminated now in autism, probably contributing to the increased incidence of autism and also to many chronic complex illnesses, including many cases of autoimmune disease and evidence of even cancers. So what activates these retroviruses, causes them to proliferate in our body? Dr. Klinghardt presented evidence about a couple of different things that he's very concerned about that seem to play a role here. One of them is the toxic metal aluminum, which he pointed out that there's lots more aluminum in the environment today that gets in our bodies than ever in the past. For one thing, it's in certain medicines that we might get. It's also in certain personal products. For example, there's a lot of aluminum in underarm deodorants, and there's aluminum in certain antacids that we might take for acid stomach problems. The other thing that seems to really play a role in activating these otherwise dormant or quiescent viruses in our DNA is electromagnetic frequency. And there's some really good evidence to suggest that the increased amounts of exposure to microwaves and Wi-Fi is really playing a significant role in activating these retroviruses. So how can you screen for them? Well, it turns out that one test that can be utilized is one called the nagalase, Nagalase. And this is an enzyme that can be measured in the blood, should not normally be present in your blood. It's only present if the retroviral DNA codes for the production of this enzyme in the body. If it's elevated, it's problematic because nagalase actually plays a role in breaking down some of our own tissue proteins, which actually play a very big role in activating our normal immune system function. So nagalase appears to be an enzyme that certain bad germs or stealth pathogens can make, which partially disenables or defeats the normal function of our immune system. So Dr. Klinghardt did point out some things that can be helpful there. One of them is an herb from the Mediterranean basin of Europe called Cistus incanus, which is available as a tincture and also as a tea. He talked about sulforaphane, which is an active ingredient in broccoli sprouts. And there's a number of herbs that are also beneficial, including Chinese skullcap. BioPure, which is a herbal company, and Dr. Klinghardt serves as one of their medical advisors, is coming out with a new tincture with a number of different agents that are shown to be active in suppressing the effects of these endogenous retroviruses. Another great lecture was given by Kiran Krishnan, and Dr. Krishnan is the Chief Science Officer for Microbiome Labs. They're the manufacturers of the probiotic Megaspore, which is a spore-forming bacillus species probiotic, which we found very beneficial in our practice, and there's a lot of solid science behind it. But Dr. Krishnan was talking a lot about the gut lining, the intestinal lining, especially the small intestine, and the role that toxins play in damaging the lining of the small intestine. These would include some of the toxins that we've talked about, such as the toxic metals, even glyphosate, certain foods. We know that the glutens from grass grains are pretty inflammatory to the inner lining. But he talked about the normal inner lining being not especially permeable. It's permeable to the nutrients, but it's not permeable to the toxins unless there's been injury or damage. And that injury is sometimes called intestinal hyperpermeability, or we often call it just leaky gut. Now, these are not macroscopic leaks that you can see with your naked eye, but they're microscopic, and in some cases even require electron microscopy to really identify these. Now, there are tests that you can run that will indicate the degree of leaky gut or intestinal hyperpermeability. But Dr. Krishnan talked about the role of certain probiotics, such as these spore former bacillus species. He talked about the role of some agents that are prebiotics that can help assist in the formation of the normal mucus lining that protects the inner lining of the gut. Seems to be very important in preventing leaky gut. And there's a number of amino acids that play a role there, including some of the branched chain amino acids. Also very important in this is the amino acid glutamine. And it's been shown that immunoglobulins, such as from bovine serum immunoglobulin, can play a very big role in terms of restoring normal mucus lining. So they have some products that are beneficial there in their lineup. He also talked about postbiotics, one of the main ones being the small short-chain fatty acid molecule called butyrate, which is very healthy for the gut. It actually feeds some of the normal bacteria, and it also feeds the inner lining of our large intestine, the colon. So butyrate is very valuable in the gut, and you can assist it to be made by taking certain prebiotics if the gut is appropriately colonized with the kinds of bacteria that can convert those prebiotics, such as resistant starch, into butyrate, sodium butyrate, magnesium butyrate. We also heard an excellent lecture from Dr. Theo Theoharides, who is just a brilliant researcher, has done some of the key work with mast cells. and talking about the effect of mast cell activation or mast cell stimulation, which is often occurring from various toxins in the environment. But he talked about the interplay between the mast cells and the body's autonomic nervous system, particularly through the cell danger response. He talked about the role that luteolin can play in terms of helping to stabilize mast cells, prevent their effects. One of the main mediators that mast cells release when they activate is the small molecule histamine. He has a line of supplements that are very beneficial, and a lot of the participants gave testimony that it had been very helpful in their clinic, especially one called Neuroprotect. It's Neuroprotek. So just wanted to present a few of the highlights of the conference, the Forum for Integrative Medicine in Seattle. The 2019 conference was well attended. There were 250 physicians, naturopathic physicians, medical doctors, doctors of osteopathy, chiropractors that were there attending. It was exciting to see. This was twice as many attendees as the conference last year, a bunch of passionate healers, and there were some great booths set up for lab testing and various nutraceuticals and vitamins retailers that were also there to present what they can offer in this area. So just hope this has been helpful. If it has been helpful, please subscribe to my YouTube channel. Please share the video with your friends and family. And feel free to comment. I'm always anxious to hear your comments. Or if there's other specific videos, anything you'd like to learn, please let me know. I'm happy to try to get as much information out there as I can in a way that's going to help people get over their chronic complex illness. Have a great day.